Hello, I'm Dr. Craig Keebler, and I want to welcome you to this YouTube video, which will provide you with actionable and science-based data about how breast cancer survivors can improve their long-term survival rates and also reduce the risk for breast cancer recurrence. But before we get to that, I first want to explain to you why I so believe that the 5-year breast cancer survival illusion is so deceptive. First of all, it implies that 5 years is the ultimate goal after breast cancer diagnosis and treatment. Now, most survivors I know want to live a lot longer than 5 years, and wouldn't you? The second thing is the repeated emphasis on 5-year survival promotes the misconception, the fantasy, that once a woman hits 5 years, the chances for breast cancer recurrence drop significantly or are even non-existent. Nothing could be further from the truth. As Horta Bagyi, a breast cancer investigator, stated beautifully, unlike highly curable cancers such as acute leukemia, Hodgkin's disease, and testicular cancer, the course of breast cancer is much more of a chronic nature. 5 and even 10-year survival is not equivalent to a cure. In fact, breast cancer survival rates decline steadily over time. I spent many hours searching for genuine science-based information about long-term cancer survival. And to me, long-term survival rates begin at 20 years and should extend beyond that. But all I could find was dozens and dozens of graphs and breakdowns about 5-year cancer survival. The only place I really found long-term survival rate information was from the SEER program. Now, SEER stands for Surveillance, Epidemiology, and End Results. And what their information showed me, looking at all breast cancers, all stages of breast cancer, 5-year survival rate was actually 86%. 10-year survival rate were 78%. 15-year survival rate, 71%. And 20-year survival rate, only 65%. Now, let's put that in a graphic display that visually it's quite obvious. Over time, survival rates decrease steadily. Now, if we look at the 20-year survival numbers here, 65% are surviving. That means that those women diagnosed with breast cancer at age 51, 1 in 3 of them will be dead before age 70. 1 in 3. To me, that's shocking and disturbing information. These disappointing facts make it more imperative than ever that we find effective and easily actionable ways to cut breast cancer recurrence and boost survival rates. What do our top cancer organizations have to say about improving cancer survival? Here's what the American Cancer Society recommendations are. 1, eat better. That means avoid red meat, avoid processed meats and lunch meats, avoid refined grains. Eat plenty of colorful vegetables and fruits, but not fruit juices. Avoid alcohol and avoid tobacco. Number 2, lose weight. Number 3, increase physical activity. Now, I can tell you, after working 20 years as a specialist in changing dietary and physical activity patterns in hundreds of obese and diabetic patients, that these 3 recommendations are extremely difficult to carry out and even more difficult, almost impossible to sustain over long periods of time. Only when we worked with individuals at a personal level to find where their points of readiness for making changes were, and then gave them intensive support in making new and better habits, did these 3 recommendations have even a chance of succeeding. Such simplistic advice, without providing the intensive support needed to carry out the advice, is not only ineffective, but it's highly discouraging to the consumer who hears these recommendations. What does the American Cancer Society say about vitamin supplements? They say that the available research does not support the belief that taking vitamins, herbs, or other nutritional supplements will give an extra edge in preventing cancer recurrence. The American Cancer Society also states that blood tests can show if a particular vitamin is in low levels in the body, and that your doctor may advise you to take an extra vitamin supplement to help that particular vitamin level up. However, they state The evidence so far does not show that higher vitamin levels help lower cancer risk. I'll show you a number of recent scientific publications that studied blood levels of vitamin D and the risk for breast cancer recurrence and its effect on breast cancer survival. These studies directly contradict the American Cancer Society's statement about the uselessness of increasing vitamin levels in preventing recurrence and enhancing survival. These studies all validate a simple, inexpensive, and low-risk way to boost cancer survival and to cut cancer recurrence. This is done without dieting, without losing weight, and without becoming a gym rat. Before we look at these important studies, let's get familiar with some critical scientific terms used in the studies. First, breast cancer can be split into 4 basic categories. Post-menopausal breast cancer is when the diagnosis is made at age 50 or older. Premenopausal breast cancer is when the diagnosis is made before the age of 50. Hormone receptor positive or HR+, receptor positive or HR+, means that the cancer cells had receptors to female hormones, and hormone receptor negative or HR- means that the cancer cells lack receptors to female hormones. Postmenopausal breast cancer is much more common, constituting about 80% of all breast cancer cases. It is also much more lethal, with as many as 35% of women dying. Hormone receptor positive breast cancers are much more common, constituting about 84% of all breast cancers, and they are also less lethal than our hormone receptor negative breast cancers. All 3 studies that we'll look at measured levels of vitamin D in the blood serum. Almost all of our vitamin D is stored in blood. The scientific name for this form of vitamin D is 25-hydroxy vitamin D. For simplicity, I call it just 25D. In the United States and some other countries, 25D is measured in nanograms per ml, which is abbreviated NG/M capital L. However, in some countries a different unit is used. There they use nanomoles per liter, which is abbreviated NMOL/capital L. If you ever read a scientific publication about vitamin D, be sure to know which of these 2 units are being used by the authors of that paper, because they are not the same. 1 nanogram per milliliter is equal to 2.5 nanomoles per liter. If you're reading a paper that has nanomoles per liter, you can change that number into nanograms per milliliter by simply dividing the nanomoles per liter by 2.5. There are several key levels of 25D that we should all become familiar with before looking at these studies. 10 nanograms per ml is the level which can prevent rickets. Now, rickets was the very first disease in 1926, could be treated and cured with supplementation of vitamin D, and the level that happens at is 10. Less than 20 nanograms per milliliter is considered by almost all top vitamin D scientists as vitamin D deficiency. 20 nanograms is deemed adequate by U.S. governmental health agencies and other American medical organizations, but this data is at least 40 years out of date. 20 to 29.9 nanograms per milliliter is considered to be vitamin D insufficiency. It's not low enough to be deficiency, but it's also not high enough to be adequate. So it's called vitamin D insufficiency. Now, there's plenty of diseases that are much more common when vitamin D levels are insufficient, but they're even more common when vitamin D levels are deficient. Now, finally, 30 to 100 nanograms per ml is considered by almost all top vitamin D scientists to be adequate. We use the adequate term rather than normal or ideal because we still are not fully certain what is the ideal level of 25D, but we're getting much closer to that answer. I discussed that interesting information in another YouTube video entitled Paleo Levels of Vitamin D. Now let's explore these important studies. Study 1 was done by Vrieling and her team, and they followed 1,295 patients diagnosed with breast cancer. They measured 25D after the diagnosis of cancer was made. The average 25D level was 18 nanograms per ml, clearly in the deficient range. Patients were followed for 6 years, looking for cancer recurrence and or death. Vrieling's first findings were concerning the issue of death. The higher the 25D level, the lower the death rate. For each 4 nanograms per ml rise in 25D, there was a corresponding 7% decrease in death rates. Now, what does that exactly mean? Let's look at 2 women, Ms. Green and Ms. Williams, and their 25D levels. Ms. Green has a 25D of 50 nanograms per ml, while Ms. Williams has only 12 nanograms per ml. Can you guess which of the 2 women will have the higher chance of dying from her breast cancer? Let's figure it out. Ms. Green's 25D is 36 nanograms per ml greater than Ms. Williams. That 36 nanograms per ml contains 9 units of 4 nanograms per ml, each one of which will cause a 7% reduction in death rate. So Ms. Green is 63% less likely to die of her breast cancer than is Ms. Williams. It's astounding what a higher 25D will do to lower death rates. Vrieling's second finding relates to the chances for recurrence of the cancer. The higher the 25D, the lower the chances for breast cancer recurrence. Again, for each 4 nanograms per ml rise in 25D, there was a corresponding 13% decrease in the risk for cancer recurrence. You can do the same calculations that we did in the previous example by taking any 2 25D values, finding the difference between them, and seeing how many 4 nanograms per ml units are in that, and then multiply that by 13%. Study number 2 was done by Peng's team. They followed approximately 240,000 healthy women for 46 years. About half were premenopausal and about half were postmenopausal. Of those women, 5,561 developed breast cancer, stages 1 through 3. 25D was measured. Hormone receptor status was also determined on each case. Their findings look at cancer recurrence. Again, the higher the 25D, the lower the chance for cancer recurrence. For each 5 nanograms per ml rise in 25D, there was a corresponding 13% decrease in recurrence rates. However, that was only found in hormone receptor positive cases. In women with hormone receptor negative, there was no benefit to higher levels of 25D. Now, it's amazing to me that these 2 different studies, this one done in the US and Vrieling's done in Germany, came up with the same rate of reduction in recurrence when 25D was higher. Whenever different studies performed by different teams in different locations come up with very similar results, this is highly confirming that the results are quite accurate and true. Now, you may wonder why hormone negative cases showed no benefit from higher levels of 25D. It turns out that as cancer cells become more and more abnormal, they begin to lose more and more of their normal function. One of the functions of breast cells is to produce receptors to female hormones, and another function of these cells is to produce receptors to 25D. So as a cancer cell or cluster of cancer cells becomes hormone responsive negative, it's very likely that those cells are also negative to receptors for 25D. That means that hormone receptive negative cancers have lost their ability to recognize higher levels of 25D, and so those cancer cells cannot be fought off with higher levels of 25D. There are actually dozens of mechanisms by which higher levels of 25D can inhibit cancer growth and spread. None of those can be of benefit in an advanced tumor that doesn't have receptors to 25D. Study 3 is by Radom. They compared 25D levels in women with a history of breast cancer to a group of women equally matched who didn't have a history of breast cancer. What they found was that 67% of breast cancer survivors had vitamin D deficiency, that is 25D below 20 nanograms per ml. But only 8% of women without a history of breast cancer had such low levels of vitamin D. Cancer survivors have 8 times greater chances of having vitamin D deficiency or very low levels of vitamin D. The question, of course, becomes why. What this study suggests the concept that our bodies use up stores of vitamin D in the blood to help fight off persisting cancer cells. In doing that, we're using up the 25D, so survivors tend to have lower levels of 25D. And these low levels of 25D have 2 important consequences. Number 1, they make it much harder to fight off the cancer, and so recurrences are greater. Secondly, besides the issue of breast cancer, low levels of vitamin D make dozens of other diseases much more common. Now, you may have heard of cases where a woman is a survivor of breast cancer, but now she develops high blood pressure, diabetes, heart problems, stroke, heart attack, and so forth. Numerous other serious diseases are recurring because our 25D levels are so low. Finally, study number 4 was carried out by Lim's team, and they studied 455 women with breast cancer stages 1 through 3, and all of them were hormone receptor positive. All of these patients were treated with 5 years of anti-hormone therapy, meaning anti-estrogen drugs, and they all had their 25D measured after the completion of that 5 years of anti-estrogen therapy. The women were divided into 2 groups based on their 25D level. Those with 25D below 20 were in one group, and those with 25D 20 or higher were in the other group. They found 3 important things. 1, if a woman fit into the below 20 nanograms per ml 25D level, she was 2.3 times more likely to experience a cancer recurrence, and she was 17.5 times more likely to have spread of the cancer into her lymph nodes, and 2.4 times more likely to have cancer spread to bone or to other distant organs. So, after hearing these 4 studies, I want to give you 4 important conclusions. 1, higher 25D dramatically reduces the chances for breast cancer recurrence. The higher the 25D, the lower the recurrence rate. Number 2, higher 25D levels increase the chances for survival. The higher the 25D, the greater the chance for survival. Higher 25D increases the chances for cancer-free survival. Now, cancer-free survival is the ultimate goal. You're not just alive, but you're free of cancer. The higher the 25D, the higher the cancer-free survival. And finally, hormone receptor status is of critical importance because when hormone receptors are positive, higher levels of 25D are very effective in lowering recurrence rates and boosting survival rates. Those with hormone receptor negative cases don't get such a benefit. So here's the bottom line. You can choose to either believe the Food and Nutrition Board of the Institute of Medicine, which maintains that 20 nanograms per ml of 25D is adequate for most adults, despite what scientists have proven over the last 42 years. Or you can choose to believe the American Cancer Society, which states that higher levels of vitamins do not have any benefit in cancer recurrence. Or, number 3, you can allow this most current information as presented in this video today to influence your choices. Regardless of which path you choose, here are 5 words of caution. Number 1, I strongly recommend that you consult with your healthcare practitioner, whether that's a doctor, a nurse practitioner, or a physician assistant, as you make your choice. If they are not current on vitamin D science, find a practitioner who is up to date. Number 2, There are rare cases of diseases that do not respond well to adding large doses of vitamin D. Number 3, your healthcare practitioner should know all of your healthcare problems and be able to tell you if you have one of these rare conditions. Number 4, this is particularly important for women 60 years of age or older, where hyperparathyroidism, overactivity of the 4 small glands surrounding the thyroid, hyperparathyroidism can easily be masked by very low 25D levels, and then adding 25D can excessively elevate calcium levels, which can be very dangerous. Therefore, number 5, all people over age 60 should have both a 25D level and a blood calcium level measured before starting D supplementation. The 6 facts you must remember in a nutshell are: 1. Higher 25D levels lower breast cancer death rates. Number 2. Higher levels of 25D prolong cancer-free survival. Number 3. Higher 25D levels have excellent response in women who have had hormone receptor positive breast cancer. Number 4. Higher 25D levels do not have the same benefit in women who had hormone negative breast cancer. Number 5, breast cancer survivors have 8 times the rate of very low 25D levels as do women who have had no breast cancer. And finally, number 6, higher levels of 25D do not only boost survival and cut cancer recurrence, they also have an impact in preventing a number of other diseases. A few of the dozen diseases that are more common and more severe when 25D levels are very low include other cancers, recurrent infections, death from respiratory infections such as flu, COVID, and pneumonia, type 2 diabetes, excessive weight problems, atherosclerosis with resulting heart attacks and strokes, virtually all autoimmune diseases, and Alzheimer's disease and other dementias. That wraps up this video lesson. Thank you for your interest and your attention. I welcome your comments and questions. I look forward to seeing you again soon in another video. As always, the scientific references supporting the information in this video are available at my website, drkeebler.com.